Good morning, and welcome to the October edition of Treasurer Folwell's Ask Me Anything Media Availability session as part of our Transparency Initiative. Thank you all for joining us. Before the Treasurer has opening remarks, please make sure to mute your phone so that we don't have any background noise. And again, thank you all for being on the call. Treasurer?
Thank you, Frank, and thank you all of you for joining us. We know it's a busy time in North Carolina and some of our communities with elections, so we appreciate you joining us. Basically, what we're involved in right now very deeply is our open enrollment process. Nearly 800,000 North Carolinians or retirees or active employees are going through this process. We're very excited. Last year, it took almost over 50 clicks to get through our open enrollment process, including one survey that people did that had over 32 questions on it. We've now reduced this to less than 10 clicks. We've had great feedback from our customers, which are the participants of this plan, and I'll be glad to answer any questions about open enrollment. Basically, what our members are finding in open enrollment this year is that we have frozen family premiums for 2018. We have frozen employee dependent premiums for 2018. We are offering a Medicare Advantage product that has no deductibles, and we were able, even in light of the health insurance fee from Congress, we were able to freeze those premiums for 2018 also. There was the implementation of a monthly fee for active employees, and we'll be glad to answer any questions about that. Since our last Ask Me Anything, we've had a statewide press conference to announce the state health plan's awarding of the third-party administration contract for the next 5 years to Blue Cross Blue Shield. Received that awarding of that contract, and this is not a renewing of our vows with Blue Cross Blue Shield. It's a resetting of our relationship. So with that, I'll be glad to answer any questions you might have.
Dan Way with Carolina Journal.
Yep, thank you. Treasurer Folwell, I'm wondering, as Congress works on the tax reform package, will that have any ripple effects that you can foresee on North Carolina? And do you see any pressure, whether they're good or bad, being pushed down to the states as a result of anything that will happen with tax reform in Washington? Well,
my interest in tax reform is generally surrounded around this health insurance fee. Any piece of legislation that's going to get through both chambers of Congress and the president's desk that can have this health insurance fee put back in the freezer where it currently is would be a $43 million benefit just to the state health plan, and according to the Oliver Wyman report, would have a $380 million positive impact for all North Carolinians who purchase insurance in this particular way. So the tax reform, obviously there are some larger issues that would affect physical research, would affect the Department of Revenue and the like. My main interest in tax reform is to get the health insurance fee sunset for another year or two, because I know exactly what I will do with that money inside of our state health plan if they're able to be successful in doing this. 3 months ago, we asked our North Carolina delegation to take the national lead in getting this sunset for another year or two. They have shown interest in that, but obviously nothing has gotten to the president's desk. I'd be glad to answer any follow-up you have.
Yeah, so you said that you have some ideas what you would do with that money. Share a couple of those.
Oh, it's pretty simple. We started out the first 10 months of our administration talking about reducing complexity and building value. You know, going from 51 clicks to 10 clicks in our open enrollment process, not having to fill out a 32-page, 32-question questionnaire, which, by the way, 9 of those 32 questions you could answer, I don't know, including the question of how are you feeling today. So now we're dealing with sustainability. How are we going to sustain these plans and give certainty to the taxpayers, the participants, and the appropriators of money going forward? Specifically, we have one of the lowest participation rates, family participation rates in our state health plan of any plan like it in the United States. So I know that you cannot have an insurance company with just people my age in it. I'm going on 59 years old. It has to have young, healthy people in it to offset folks like myself. Our family premium is unaffordable for most beginning teachers, troopers, corrections officers, DOT workers, and other kinds of state employees. This year, if they choose the family premium, generally speaking, based on most of them's entry-level income, they have to work 5 days out of every work month this year to pay that family premium. So what I would do, Dan, with that money is that I will set about not just to freeze family premiums, but to start to lower them over the next 2 years. I think I'm optimistic that there's a real opportunity here, that as insurance rates are going up everywhere else in North Carolina, as we start to take advantage of our largeness and sign contracts that benefit our participants and not the people on the other side, that we can start driving insurance rates down. And I think the result of that is going to be a younger, healthier population inside of our state health plan, which will long-term help with its financial sustainability.
Dan, you got anything else?
Well, yeah, it's sort of related also to the federal situation, but the Concord Coalition says that federal tax expenditures from tax credits and subsidies and whatnot totaled $1.6 trillion in 2016. So I'm wondering, at the state level, we just saw the film credits extended again. They were supposed to sunset, but the General Assembly has now extended those, and the governor signed that legislation. How extensive is the tax expenditure issue in North Carolina with film credits and all these other issues that we have?
I'm not sure. Obviously, a few years ago, when I was in the legislature and chair of the finance committee, I was more up to speed on that. But the tax reform in North Carolina at the state level has been so rapid in terms of the reduction in tax rates. It's obviously a blessing to the people of our state, and our economic vitality is showing the results of that. But I haven't for a number of years connected the dot that you're asking me about. But it's a great question. But it also, your question gives me an opportunity to remind myself and others that the poet T.S. Eliot said that hell is where nothing connects. And this is not hell, this is North Carolina. And so all of your questions regarding this federal tax reform, what we do to make our state health plan younger and healthier, which would ultimately help our OPEB liability, which ultimately helps maintain our AAA bond rating. All these questions that you're asking and that we think about on a daily basis, all of it connects back to something else and that's how it all works. So appreciate the question. I'm sorry I couldn't give you more color on it.
All right. Well, thank you.
Thanks for joining us every month. Appreciate it. Well, I appreciate your interest, Dan. I appreciate your question. I think that it seems that the more press releases that we have between calls, sometimes that generates more activity on the call itself. And the only one that we've had since the last meeting was awarding of the TPA contract. But to kind of summarize, unless someone has a question or a follow-up, we're trying to figure out what's right and get it right and keep it right in our pension plan, our state health plan, our defined contribution plan. We continue to cut fees in our defined contribution plan and reduce complexity, build value, and so that these plans are sustainable going forward. I appreciate you all participating, and hope you have a good day and look forward to talking to you in November.